right, everybody. In this video, we will be studying the anatomy of the breast, and this is really the last video that deals with the thoracic wall because the anatomy, the breasts are going to be above the thoracic cage, so we're going to talk about them. So in this video, we will describe the location, structure, blood supply of the breast, and describe the lymphatic drainage of the breast. We are not dissecting these in lab, or you may have seen them, you saw them, but that's really because in elderly females, there's not much there besides adipose tissue, so there's not really a good reason to do the dissection, but we're going to study them just a little bit here in class because there are some very important clinical applications. So let's go ahead and get started. So when we're talking about the breast, we're talking about a specialized gland, an accessory gland of the skin that's capable of secreting milk. So this means they embryologically, they originate from the skin, and in males and immature females, they're rudimentary, and then, in mature females, they have an important, role in pregnancy and then in breastfeeding. So in this photo that we're seeing here, we're seeing the breast of what would be a pregnant or a breastfeeding female. And the reason why I know that is because once puberty hits, the breast will enlarge, and you guys know this, into this hemispherical type shape under the influence of hormones that are coming from the ovaries. The glandular tissue does increase some, but most of the size increase is due to fatty or adipose deposition. The glandular tissue, which you see kind of in this light pink here, is only fully developed when breastfeeding or when pregnant, and that's why I can tell that this is pregnant or a breastfeeding female, because the glandular tissue is just so large. So when we're talking about the location of the breast, you can see on this side here, vertically, we're going to see it start about the second rib, which is labeled, all the way to about the sixth rib, which is also labeled. And if you look horizontally, it's going to be from the lateral margin of the sternum. So right here, the sternum, if we looked below, we'd see it, all the way to the mid-axillary line. So mid-axillary line, that's going to be the line that splits, kind of the middle. If you reach to your side, what would be the middle of your side close to your armpit? That's the mid-axillary line. And then what we see also is that each breast has these lobules. So here we see all the lobules, and these lobules will radiate from the nipple, and it's well visualized here. And these are the glandular tissue of the breast, so the glands. So the main duct of each lobule will have a duct called the lactiferous duct, and each of the lobules will have their own one that will open separately at the nipple. And so if you look at the nipple, there's going to be about 15 to 20 openings, or it's also going to be a small dilation of it, or lactiferous sinus or ampulla, before it terminates, okay? So each ampulla has its own gland that will open separately at the nipple. Now, the base of the nipple is going to be surrounded by this colored area of skin that has little small elevations on it, and we call this the areola. And the small little elevations are going to be called areolar tubercles, and they're going to be caused by glands that lie below. Now, you can see in this photo this little kind of separations between each gland, and those separations uh, are little fibrous separations or fibrous septa, which extend from the fascia of the pectoralis major. So the breast covers pectoralis major. So it'll extend from the fascia of this muscle to the skin. And so this is known as a suspensory or Cooper's ligament. So it's labeled right up here, suspensory or Cooper's ligament. And this is going to be important because when there's a pathological process such as cancer or any kind of infections that cause abscesses, it can cause dimpling of skin. So this could be a sign to a female or a male even who isn't doing regular breast exams and hasn't noticed a lump. They may notice these dimpling of the skin, and that dimpling of the skin could be a sign of a pathological issue such as cancer. Now, behind the breast, there's going to be a space called the retromammary space, and the retromammary space is just going to be loose connective tissue that separates the breast from the deep fascia that covers pectoralis major. So, in summary, when we're looking at the structure of the breast, it's going from the vertically second to the sixth rib, medially from the lateral aspect of the sternum, laterally to the mid-axillary line. You're going to have 15 to 20 of these glandular lobules, which will only be fully developed during pregnancy or when breastfeeding. They each have their own duct or lactiferous duct, and they all open separately at the nipple. They are all separated by these fibrous septa or the suspensory or Cooper's ligaments that go from the fascia of pectoralis major all the way to the skin. And this is where we will see dimpling of the skin if there's a pathological process happening. And then right behind the breast is this retromammary space, which is just going to be loose connective tissue that separates the breast from pectoralis major. Now let's talk about the blood supply of the breast. So let's look at the arteries first. There's going to be two different sources of blood to the breast. If we look medially, we have these perforating branches from the internal thoracic artery, which we spoke about earlier when we were talking about vessels of the thoracic wall, and we talked about the branches of the internal thoracic artery. So you're seeing them pretty well here. Remember, these vessels will perforate pec major and then make their way to the breast to supply the breast. Also, you get laterally, we get branches from the lateral thoracic artery. So we see the lateral thoracic artery here, and it's giving off these branches, these lateral mammary branches. And we'll talk about the lateral thoracic artery more next try. The lateral thoracic artery is going to be a branch of the axillary artery. So here we have the subclavian artery, and the axillary artery is just a continuation of the subclavian artery once it passes the clavicle, and it goes all the way to the inferior border of teres minor, where it then will become brachial artery. So we'll be discussing this when we talk about the upper extremity in GROS 2. And the lateral thoracic artery is a branch of the second part of the axillary artery, and it will give these lateral thoracic branches. So this is neat because you'll see this more often. I think this shows this very well, that a lot of structures in the body will get blood supply from two different sources, and with that, there's always a way that blood supply can get to spaces if there is a problem that is preventing, say, the lateral thoracic artery from getting blood supply to the breast. So we'll see that more and more as we go through our studies, since we're really just getting started with blood supply now. Now, veins are going to have a similar story to the arteries. The blood from the breast will mainly drain into the internal thoracic internal thoracic vein. So these perforating branches will come back to the internal thoracic vein. the lateral thoracic, and then you also will have these lateral mammaries that will drain into the lateral thoracic vein, and then also there will be some that will drain into the posterior intercostal veins. So remember that the posterior intercostal arteries, you will have some of the blood supply from the veins of the breast that will drain into the veins that accompany that artery, so the posterior intercostal veins. So now we need to talk about what is most important that we need to know about the breast. This is most important for you clinically. You are going to see this again in gross anatomy too, but this is just very, very important to you as a clinician. So lymph vessels are a component. They are usually highly involved in dissemination of malignancies from carcinomas of any area, but of the breast to regional lymph nodes. So there's a lot of lymph vessels around the breast, and so this is where we see it. So you'll learn in pathology next try about the different types of cancers, but carcinoma of the breast is derived from epithelial cells. So it's going to be carcinoma of epithelial cells, and then you'll hear the word sarcoma, and that is mesenchymal cells. So carcinoma is epithelial, and that is what we'll see in the breast mostly when we have a patient with breast cancer. Now, approximately 75% of the lymph of the breast will drain into the axillary lymph nodes. So you see all these green here. These are the axillary lymph nodes. In particular, they will drain mostly into the anterior or pectoral lymph nodes. So you see these lymph nodes right here, pretty close in relationship to the breast. Most of the lymph from the breast will drain into the anterior or pectoral lymph nodes. And then the rest of the drainage will come over this way and drain into intercostal lymph nodes that are located near the head of the ribs. And then some will even travel a little posterior, but most of what you see will travel to these pectoral anterior lymph nodes of the axilla. So again, we'll talk about that next try. And then even more, some of the other lymph will travel and communicate with the other breast. So you see these green veins, or not veins, but lymph vessels here. That is lymph that is communicating with the other vessels. But again, most of them is draining right here. So if a patient, this is why it is important to palpate, say, the axilla when doing a breast exam, because this could be a spot where a lump will form when someone has breast cancer, because the lymph is going here and this will become malignant. So now we should be able to describe the location, structure, and blood supply of the breast, and to describe the lymphatic drainage of the breast.